When we take an aeroplane, always like to draw this parallel to the parents who sits in my clinic. When we go on the plane and the air stewardess and the air stewards will explain to you the safety features, the safety regulations. And one of the things they will say that, when the air mask dropped in the case of low oxygen and all that, they always tell us that parents, please put the mask on yourself first before you place the mask on your dependent. This principle is very important. I think it's applicable especially to parents with children with special needs. There are two key issues that we look at here. First is that the children with special needs are very sensitive to the parents' emotions. If the parent is anxious or the parent gets upset and angry easily, you find that the child will be more reactive. So if the parents do not make an effort to ensure that they are not overstressed, they are not emotionally overwhelmed, they will find that their child will also be consistently emotionally overwhelmed. So that's why it is very important. I always tell parents that anything happens, you have to stay calm, because if you can stay calm, it is easier for you to calm the child down. The next thing is also, if you are not able to stay calm, you develop your own mental health issues. I've seen a lot of cases where I have to work with the mom who is probably facing emotional depression, some anxiety disorder, because most of the time the mother is the main caregiver, and then with her career, the family, and sometimes there are more than one child, it's very easy for the mom to go into depression, have a guilt complex, and a lot of other issues. Inability to take care of the child, inability to take care of all the other children, inability to take care of the family. And after that, you find that the family unit collapse. So it is very, very important, whether it is the mom, particularly the mom, and also the parents, to ensure that they take care of their health, and they take care of their relationship health too, and to ensure that they can be calm and they have a focused mind, that they know exactly what they're doing, how they're going to cope with the needs of the children. And children with special needs is a big spectrum. You got those who are very high needs to those who are very high functioning. Parents with children who have very high needs, all the more they need to take care of themselves, because 24/7 they have to meet the needs of the children, they have to take care of their children, they have to ensure that children are not being bullied, they ensure that the children, all sorts of things, they're eating well, they are learning, they are meeting their developmental milestones. Whereas for children who are higher functioning, the parents might not have so many things to worry about, but they have other issues they need to deal with. So if a parent is not mentally stable, the parent not able to cope with the stress, you find that it is very difficult for them to be able to plan, and take care of the needs of their children. Number two, one of the very important things for parents to have is to have a community of support for themselves. It really takes a village to raise a child, with or without special needs. So for parents with children with special needs, they really need to have a very tight group of support, whether be it immediate family, be it friends. They must always have a hobby. It's something very fundamental. I have a hobby. I have kids with special needs. You need to find time for yourself. Just go and do things with your friends and let go of your children first. I always tell the parents who step into my room, especially the mothers, I said, you must always remember you are a person first, right? Before you are a mother, before you are anything. So you are yourself first. So to have that self-identity, to understand that what is it that keeps you going? What is it that makes you happy? When we do dialectic behavior therapy, one of the therapeutic processes for emotion regulation that we go through with adults and kids is called accumulating positive experiences, because these are the positive experiences that will cushion you through the hard times. So when parents individuals accumulate positive experiences for themselves, they are building their own resilience and building their own forge and walls for difficult times. And when you can do that, you can also build positive experience together with your children. And then you forge that resilience to difficult times together with your children.